Hey guys, I wanted to tell you what's going to happen this week. So, you shouldn't have to live in pain is the title of this post and video. So what I'm going to be going through this week is taking you on my journey of my whole, everything that went on with my back in the past year. Most of you know and have heard part of my story, but you know what causes back pain? It could be 5 million different things. And I honestly don't even know what started mine. I really don't. But I mean, like, you can have a sprain, a strain. You might be just doing something day to day without the right form, and that can cause pain. But there's a difference between long-term pain that is just all the time or pain from just a small injury. And that's where you kind of want to know, like, okay, is there something that I can figure out, something that I can get past this pain, you know? Degenerative disc disease and scoliosis and I said sprains and strains. What is herniated discs in my lower back? So there's like herniated discs, ruptured discs, all kinds of crazy things. Did I say spinal stenosis? There's just so many different things that can cause your lower back pain, and you want to make sure that you know exactly what it is. You don't want to guess. You don't want to try to fix it yourself. So what I'm going to do is share with you my journey from just this past year, like I said, because for 13 years I have suffered from lower back pain, and I've been going to the chiropractor. Now, a lot of people are like, wait, you're going to the chiropractor for 13 years? You're not fixed yet? And I'm like, well, I went to the dentist 6 months ago and I didn't have any cavities, but I'm also going to next month. So why would you kind of stop maintaining that if you don't, you know what I'm saying? You go to the dentist every 6 months. Why would you say, well, I'm just not going to go to the chiropractor anymore? And people are like, well, why haven't you had surgery yet? Because I don't want to have surgery. I found a way to not have to have surgery. If you follow my story, you're going to know that I was told in November that I needed surgery. And it's now March and I haven't had surgery. You know, I mean, everybody's different. Everybody has back pain for different reasons. So I'm going to take you on my journey of pain because it's not something that was healed overnight. There was frustration. There was second guessing. There was misunderstandings of what actually I had going on. You know, I mean, I still have 3 herniated discs. They're not going anywhere, but to me, it's like I went through the physical therapy. I've gotten the shots. I'm working on trying to find a way to handle it without having surgery. And I've had so many people that I've talked to that have lower back issues, so many people that have neck issues, joint issues, that either are rushing for surgery, sticking with pain pills, and you don't have to do that. So I'm going to take you all the way through all of what I do as to what causes the back pain. You know, I've given you things that could cause the back pain. In my specific issue, I don't know what caused it. I blame it on the fact that my son was a beefcake and I carried him on my hip and he made my discs bulge. I was never in an accident. I never was hurt. I never fell before that. Since that, yes, those things have happened and have caused flare-ups and issues. But I'm going to take you exactly on the journey from November until now to where I went to the point where I couldn't walk straight. I was completely crooked. Funny thing is these videos that I do, I actually have one of me standing up in November and I was standing crooked. So I'm going to take a still shot of that one and I'm going to show you how crooked I was. My pain level was probably 10 plus. I couldn't walk. I couldn't touch my toes. Sleeping was hard because I couldn't get comfortable. Forget about working out. I couldn't, you know, it was very hard for me to teach my classes. There was a lot of stuff that I couldn't do that now I'm about 98% pain-free. So you're coming on the journey with me this week. You're going to find out what exercises I do. You're going to find out what doctor I see. You're going to come with me to the doctor. You are going to find out, you know, how to strengthen your core, because if you don't have a strong core, your back makes up for that. You know, it's this whole girdle thing. It's not, oh, I'm going to do 500 crunches and have a strong core. It's not that. There's so much more to it. So you're going to learn about that. You are going to stretches. What did I say? Stretches, exercises, core strengthening. You're going to come with and meet the doctor that I go to, that fate would have it that I met him at the gym, which was strange and unusual because, like, I never would have met him or anything like that, and I probably would have gone back to that doctor and probably been recovering from surgery right now. So I just want to let you know that my case may be different than yours, but I want to open your eyes up to the fact that maybe, just maybe, there's an alternate way to where you don't have to live in pain, and you can do your day-to-day activities without having to take 5 days off. I can remember, I used to wear a back brace when I would clean the house, and literally even that wouldn't even help. And I seriously just, like, bending over to clean a toilet or whatever and cleaning the tub, I would be in pain for days after that. I didn't want that. I didn't want to be in pain, but I also knew that surgery may not be the answer because you can't undo what's been done in surgery. So that was something that always scared me. So I've always looked for alternatives. So that's why 13, 14 years later, I'm still doing some of the things that I did in the beginning, and I'm learning more as to what actually caused my pain, what actually exercises I should be doing that would avoid the pain and help the pain. So you guys are coming with me this week on this journey of my back pain since November, going from not being able to walk, not even be able to sit for a few minutes, and ending up to, you know what, I'm right back to where I was before all this back pain started. And remember, that was 13 years ago. So if you're in pain, and I don't care if it's back, neck, elbow, knee, whatever it is, okay, and you've been told and you're contemplating, what should I do? Should I have surgery? Should I not have surgery? I urge you to watch this because it is not just going to be for back pain. Yes, it will be specifically geared on my back pain, but when we go see this doctor this week, you're going to see a whole different thing as far as how you can actually, through movement, kind of fix yourself just by his guidance. So you guys keep an eye out for my lives, and we're going to go from there, and I want you to watch it. And if you know someone who maybe is suffering from back pain, please share this with them. If it's not even this video, make sure it's the one where I go to the doctor and you see, and I show stretches, and I'm showing exercises and things that will help, okay? Because that is something that I feel, one person after the next is like, I'm going in for back surgery, I'm getting this done, I'm getting that done. I had a discectomy, whatever you want to call it. And now I have to go get fusions because I don't have any cushion left in my spine, and it's bone on bone and it hurts so bad. I don't want that. And I don't want anybody else to have that. I want them to realize that there is an alternative and you don't have to live in the pain. Maybe the alternative doesn't work for you, but it's worth looking into, okay? So stay tuned, stay with me this week, and you will find out exactly my journey in the past 5-6 months as to how I went from not being able to walk and being able to walk, jump. I don't want to say run because me and run don't go in the same sentence so much anymore, but I probably could run, okay? So this is where I'm at. So I'm going to take you from where I was to where I'm at. So I hope you guys join along, and thank you for getting on, and I'll see you in the next episode.